Does bracing cause muscle atrophy? Bracing and muscle atrophy is a commonly held belief, and we see that anecdotally when a broken forearm is casted. When that cast comes off, that forearm is visibly smaller. So a brace, the right brace, doesn't have the rigidity or compressive forces necessary to isolate or immobilize those abdominal muscles. There's actually some great literature on bracing and muscle atrophy. Azzedine and her team actually did a literature review in which they looked at studies that made the claim that bracing caused or resulted in muscle atrophy. They limited that search to any study that actually tried to prove that. In order to validate that study, Health and Human Services did a pain management best practices in which they cited the Azzedine literature review. Azzedine and her team then went on to do an LSO study where patients were in the brace for 7.21 hours a day on average for a period of 4 weeks, had zero reduction in the muscle function. And so these three things are pretty conclusive that bracing does not result in muscles getting weaker.